Did you know that chronic obstructive pulmonary disease, or COPD, is one of the leading causes of morbidity and mortality worldwide? Yes, this prevalent disease is a major health concern that we need to address. Chronic obstructive pulmonary disease, often simply referred to as COPD, is a chronic inflammatory lung disease. It primarily causes obstructed airflow from the lungs, making it increasingly difficult for the affected individual to breathe. Interestingly, this condition is not a single disease, but a term used to describe progressive lung diseases, including emphysema, chronic bronchitis, and refractory asthma. Now, you might wonder, what causes COPD? The main culprit, especially in developed countries, is long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. However, in developing countries, exposure to fumes from burning fuel for cooking and heating is a frequent cause. Certain occupations also carry a higher risk due to exposure to dust, fumes, and chemicals. There's also a genetic factor at play, known as alpha-1 antitrypsin deficiency, but it's far less common. The symptoms of COPD can vary in intensity among individuals, but typically include difficulty breathing, persistent coughing, excessive mucus production, and wheezing. Over time, these symptoms can lead to limitations in physical activities and impact the quality of life. A crucial point to note is that symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if exposure to the cause continues. If you suspect COPD, seek medical help. Early diagnosis can improve the management of the disease. Diagnostic methods include lung function tests, chest X-rays, and CT scans. Now let's talk about treatment. While COPD is incurable, it is definitely manageable. Management strategies involve reducing exposure to risk factors, primarily by quitting smoking and avoiding lung irritants. Medications like bronchodilators and steroids can help to ease symptoms and prevent complications. For individuals with severe COPD, therapies like oxygen therapy, pulmonary rehabilitation programs, and even surgery might be options. In summary, COPD is a chronic lung disease primarily caused by long-term exposure to lung irritants, especially cigarette smoke. It presents with symptoms like difficulty breathing, persistent coughing, and excessive mucus production. While it is currently incurable, it can be managed with proper treatment and lifestyle changes. Early diagnosis and intervention can significantly improve the quality of life for individuals with COPD. So, the next time you hear about COPD, remember the key points we've discussed today. It's a disease that affects millions, but with knowledge and awareness, we can make strides in managing it effectively.